While the exact figures are not available, the Jamaica AIDS Support for Life is reporting a concerning increase in sexually transmitted infections among young people aged 16 to 24. Social media officer at the non-governmental organization Calvin Brown is partially attributing this to a glaring crack in the educational curriculum within schools.
If we look at the schools, when we do have those conversations about sex and sexual health, they don't attack the issues. They are not sufficient. They don't attack it in a real way. The conversations are just on the surface, and they don't give the real information that the youth need to know. I guess part of it is culturally. A lot of these things we find as being taboo, and especially in a school setting with so much red tape, we aren't able to discuss the issues the way that would be beneficial to the students.
He argues there is also a generalized approach to STI national information campaigns, overlooking the pressing need for more targeted programs specifically designed for youths. Additionally, the lingering stigma attached to the subject, he explains, makes some people hesitant to seek guidance, while others ignorantly think their youth makes them invincible.
Being young, they think that, okay, I'm invincible, I can't contract HIV. They don't think of HIV as something that will potentially affect them, even though they're going out there, they're having unprotected sex, they are engaging in risky activities. They don't see themselves as being susceptible for contracting HIV.
Brown adds this concerning trend also puts a burden on Jamaica's healthcare system, as it means more people will require medication and other associated services for longer periods. He emphasizes the urgency of taking control of one's sexual health and urges sexually active individuals, particularly youths, to exercise greater caution.
We've known that young girls, they engage in anal sex as a manner of preserving their virginity, and the risk of contracting HIV through anal sex is actually higher than through vaginal sex because of the thinness of the anal cavity. So it puts them at increased risk, and if they're doing this without protection, it increases their risk of contracting HIV.
The increase in STIs among young Jamaicans has prompted JASL to immerse itself into spaces occupied by young people, engaging them at parties, bars, and also providing options for the service to come to them wherever they feel most comfortable. They call for educational institutions, governmental bodies, and community organizations to play their part, as there is also a notable increase in syphilis and gonorrhea. Natalia Clark, CVM Live.